Good morning, my name is Ben and I will be doing my medication administration validation this morning, and we will begin with our chart check review. I also have here my medication cards for patient teaching and my scratch paper. So we have here Collin College Hospital Lab, patient Jane Doe, date of birth 2/22XX, Dr. J. Dudley, allergies none, full code, she's a full code, and Jane Doe is a 75-year-old female patient with a past medical history of diabetes mellitus, atrial flutter, and hypertension. She has been admitted to the unit with a diagnosis of acute diverticulitis, and she is complaining of a pain level of 3 and no complaints of nausea. The current time is 08:30, and I will complete med administration per provider orders and all documentation. Vital signs this morning is 140/86, heart rate 86, respirations 18, temperature is 98.8, and she has a pain level of 5/10. Next, I will review physician orders. Patient Jane Doe, date of birth 2/22XX, allergies none, Dr. Dudley, and the orders are for today at 08:30. Admit to Collin Hospital Lab, med-surg floor. Diagnosis is acute colonic diverticulitis. Diet 2,008 calorie ADA diet. Activities no restrictions. Vital signs every 4 hours. Lab orders, CBC, BMP every morning, a digoxin level today, capillary blood sugar, ACNHS, and there are there's some medication orders on here that we will discuss during medication reconciliation. I'm now going to review the labs. Patient is Jane Doe, date of birth 2/22XX, allergies none, Dr. Dudley. Upon review of the CBC, white blood cell are elevated, 15,300. Neutrophils are slightly elevated, 82%. Chemistry labs, we have a glucose of 175. I will now do my medication reconciliation using 6 patient rights, which are right patient, right drug, right dose, right route, right time, and right documentation. So we have here, patient is Jane Doe, date of birth 2/22XX, 2/22XX, allergies none, Dr. Dudley, and this. All right, so for the first medication, as previously stated, for the 6 patient rights, we have digoxin 0.25 milligram PO daily, and here we have digoxin 0.25 milligram PO daily. It is due at 0900, so we will be administering that. I will sign off on the left side of my MAR. The next medication for the 6 patient rights is Flagyl, 500 milligram PO every 6 hours for 7 days. And we have here Flagyl, 500 milligram PO every 6 hours for 7 days. It is next due at 12, so we will not administer that, and I am signing off. Okay. Next medication for the 6 patient rights is Ketorolac, 30 milligrams IM every 6 hours, PRN moderate to severe pain, 4 or greater on a scale of 0 to 10. And over here we have Ketorolac, 30 milligrams IM every 6 hours, PRN pain, 4 or greater on a pain scale. This patient received it yesterday at 0100, so she is within the time frame and we can administer that. Due to her pain of 5 this morning on a scale of 0 to 10. The next medication is, per the 6 patient rights as previously stated, promethazine hydrochloride 25 milligram PO every 6 hours, PRN nausea. And we have promethazine hydrochloride 25 milligram PO every 6 hours, PRN nausea. And there is no complaint of nausea this morning, but we will still sign this on the left side. The last medication here for the 6 patient rights is regular insulin subcutaneously, AC/NHS per sliding scale. We have here regular insulin subcutaneously, AC/NHS per sliding scale. Sliding scale is as follows: less than 150, no insulin; less than 150, no insulin; 151 to 200, 4 units subcutaneously; 151 to 200, 4 units subcutaneously; 201 to 250, 6 units subcutaneously; 201 to 250, 6 units subcutaneously; 251 to 300, 8 units subcutaneously; 251 to 300, 8 units subcutaneously. Greater than 300, notify provider. Greater than 300, notify provider. And this is due at 0900 this morning. So we will give her, according to the sliding scale, her blood sugar this morning was 175. So we will give 4 units, and we will make our squares. So 175, 4 units. All right, and then I will come down and initial, print my name, and then sign. Okay, so that concludes chart review. I will now move on to MedCheck 1. And I will bring my MAR with me to the med room. All right, I will perform hand gene prior to MedCheck 1. And again, for our 6 patient rights, we have here patient Jane Doe, date of birth 222XX, allergies is none, and we are going to be looking for regular insulin. Look here, regular insulin, and again, as previously stated, for 6 patient rights, I have here regular insulin, and I have here regular insulin. The vial is intact. Solution is clear, and it expires on October 2033, so this is good. The next medication for our 6 patient rights is going to be digoxin, 0.25 milligram PO. It is due at 0900. So I have here digoxin, 0.25 milligram PO daily, due at 0900. And I have it here, the digoxin 0.25 milligram tablet. The packaging is intact. Expiration date is June of 2029. So that is there. And then the last medication we're going to be administering is the Toradol, 30 milligrams. And again, using our 6 patient rights, we are going to we have here Ketorolac, 30 milligrams IM every 6 hours, PRN pain, last given 0100, so we can give it today. And we have Toradol, 30 milligrams per ml, and the vial is not expired until October of 2033. So we will put this down. Now I'm going to gather my supplies that I need to administer the medications. I will get a 3 ml syringe, a blunt needle, and a injection needle. I will also be needing a insulin syringe and some alcohol wipes and a medicine cup. All right. So now, in preparation for MedCheck 2, I'm going to perform some hand hygiene and don gloves. Okay, so the first medication that we are going to be drawing up is going to be using the 6 patient rights, as previously stated, is going to be the regular insulin. And I have regular insulin here, and we are going to give 4 units due to the patient's blood sugar at 175. And so I am going to wipe the top for 30 seconds. While that dries, I will make my syringe ready. I will aspirate 4 units of air into the syringe. And then inject 4 units into the vial. I will then aspirate, making sure that there's no bubbles. And at this time, I will verify with the second nurse that I have 4 units of insulin. Once this has been verified, I will then remove the vial, and using the scoop method, I will recap my needle. I will then label my syringe, and I will include the patient's name, the dose of medication, and the name of the medication. Okay. The next medication is, for the 6 patient rights, is digoxin. And I have here digoxin, 0.25 milligram PO daily due at 0900, and I have digoxin 0.25 milligram tablet, and I will put that in the medicine cup. Okay, I will then also label the medicine cup, just with the patient's name on the cup. You can also put the date of birth if you choose to. The next medication using the 6 patient rights is going to be the Ketorolac, 30 milligrams IM every 6 hours, PRN pain, and it was last given yesterday, so it is okay to give today. Okay, you take the top off and wipe for 30 seconds. Allow that to dry. I will then prepare my syringe, my 3 ml syringe, with a blunt needle to aspirate. And the concentration is 30 milligrams per 1 ml, so I'm going to aspirate 1 ml. This vial is a 2 ml vial, so I'm gonna have to empty some of this. Okay, we got 1 ml. I will then change my needle, my injection needle, and then I will go and get rid of my blunt needle in the waste, or in the sharps container rather, and then I will verify that I have 1 ml. This has been verified with my instructor, and I will now label the patient's name, the drug, and the dose. Okay, I will clean off my station and get rid of trash. Make sure everything's where it needs to be. And take my gloves off. I will bring my MAR and my materials. I have my alcohol, my insulin syringe, my ketorolac, and my digoxin on my medicine tray. And I will perform hand hygiene after taking my gloves off, and then we go on to med check 3. All right, so now we are coming. We are at the patient's door. We will knock. As I am coming in, I am observing and assessing for any safety concerns, and I will close the door behind me to allow for privacy. And good morning, my name is Ben. I'm going to be your student nurse today. I have some medications and I have also your breakfast for you this morning. Can you tell me your name and date of birth? As this happens, I'm going to be, as the patient voices back name and date of birth, I'm going to compare the MAR with the name band, and she'll say, Jane Doe, date of birth 2/22/XX. All right, Miss Doe, can you tell me where you are today? And can you tell me why you are here? What brought you to the hospital? Can you tell me what today's date is? All right, do you have any allergies to food, contact, or any drugs? No allergies? Okay, great. Can you tell me what your pain is on a scale of 0 to 10? 5. Okay, so I also do have some medications for you this morning. I'd like to provide some teaching, if you don't mind, okay? So the first drug that I have for you is the ketorolac, just because of the way the list is. So I have your ketorolac, okay? This is something that we use to treat moderate to severe or even acute pain sometimes, okay? Some severe adverse reactions that I would like you to tell me immediately is if you feel like you have high blood pressure, if you notice any edema that can happen, sometimes in your fingers, sometimes your face may get a little puffy, or even in your lower extremities, please do let me know. You also do have an increased risk for bleeding because it is an NSAID type of medication. And for the nursing intervention, I would be monitoring for GI bleeding. I would also monitor vital signs, especially the blood pressure due to the adverse reaction for hypertension. The next medication that we have, Ms. Doe, is your digoxin. This is your medication used for your atrial flutter, also known as a heart or as an arrhythmia. And for this, the 3 side effects that I want you to let me know immediately is if you notice any like palpitations, blurred vision, a headache, extreme weakness, any of those things, please let me know immediately. And I will be monitoring for digoxin toxicity at that point, confusion, irregular pulse, and vision changes. And then lastly, the last medication I think you're pretty familiar with is the insulin. This is for your diabetes. And so your blood sugar this morning was 175. So based on our sliding scale, we're going to administer 4 units of insulin. And I see you had it on your left upper quadrant the last time, so I'll go on the right lower quadrant, unless you have any objections and prefer somewhere else. Okay, so at this point I will be doing med check 3, and I will perform hand hygiene and don gloves. Okay, so per our 6 patient rights, as previously stated, we have Jane Doe, date of birth 2/22/XX, allergies none, and the first medication is the regular insulin, subcutaneously ACNHS per sliding scale. We are going to be administering 4 units at this morning at 0900, and I have regular insulin 4 units, so that checks off. The next medication that we have to administer is the digoxin. per 6 patient rights, 0.25 milligram PO daily at 0900. And I have here digoxin 0.25 milligrams, and this is a tablet form. So I would open that and put it in the medication cup. The last medication is a ketorolac 30 milligrams IM per 6 patient rights. Ketorolac 30 milligrams IM every 6 hours, PRN pain 4 or greater on a pain scale. She has a pain of 5 this morning, and it was last given at 100. So we have here ketorolac 30 milligrams, 1 ml. Okay. So now I would raise the bed up to the most comfortable position. I'm now going to assess apical pulse for 60 seconds. Check. It's been 60 seconds. And I would start with administering the injection or the insulin injection. And so I would bring an alcohol pad. All right, Ms. Doe, I'm going to raise your gown up just a little bit. I would go 2 inches, I would clean on the right lower quadrant 2 inches away from the umbilicus, wipe for 30 seconds, allow it to dry. And then I would go in using a 90-degree angle and injecting the 4 units. Okay, and then pull out, and then I would take and discard my needle in the sharps container. The next medication I would be giving would be the Toradol, and I am going to bring down the side rail, and we're going to go in the right deltoid 2 inches under the acromion process. All right, so I would then take alcohol and I would wipe for 30 seconds. Okay, it's been 30 seconds. So then I would then using a Z-track method, I would pull to the side and then administer at a 90-degree angle, and then just administer slowly, pull out, and then release. If there's any signs of bleeding, then I would apply a Band-Aid. Other than that, I would throw this in the sharps container, and I would then bring the side rail back up, and now I'm ready to move on to the last drug, which is the digoxin. Administer the cup to the patient, have her swallow, provide water, and then after the patient takes her medication, I would ask the patient to open her mouth and make sure that she took her medicine, didn't pool or anything. At this point, we are done with administration. I would take my gloves off. I would perform hand hygiene, provide the food tray to the patient, and say, okay, Ms. Doe, go ahead and have your breakfast. I am now going to stand over in that corner and do my documentation, and then I'll reassess your pain in about 30 minutes. Okay? So then I would go and do my documentation. Signing off on the regular insulin. Finish filling in the 4 squares with the location, right lower quadrant, and your initials, and strike out the time. The next one was digoxin, strike out the time, put your initials. And then the last one is a ketorolac, put in at 0830. You put in your name and the location of the injection. So your your MAR documentation has been complete, and now it has been 30 minutes. I am now going to oh, I'm sorry, I did forget to bring the bed down to the lowest available position prior to doing my documentation just make sure that you do that. It's now been 30 minutes. I'm now going to re-eval Ms. Doe. Can you tell me what your pain is on a scale of 0 to 10? Great, it's a 2. Okay, so much improved. All right, so Ms. Doe, I'm going to leave you now. I'm going to take your food tray, and please let me know if there's anything else that I can get for you, and make sure that the bed is at the lowest position possible. Side rails times 2 is up, and that her call light is in reach. After that, you walk out, and you have now completed I have now completed my medication administration validation.